Welcome to today's video about early signs of lung cancer. Did you know that lung cancer is one of the most common cancers worldwide, affecting over 2 million people every year? What's more shocking is that many of the early signs are often missed or ignored. Could a simple cough or even shoulder pain be trying to tell you something more? What if recognizing these early symptoms could save your life or the life of someone you love? Today, we're diving into the early signs of lung cancer that you need to know about. Backed by the latest research and real statistics, we're going to cover the symptoms you might not expect, like how something as minor as shoulder pain could be a red flag. Stick with me, because these signs could be the difference between early detection and catching it too late. By the end of this video, you'll have the knowledge to act quickly, armed with the facts that could save a life, ready to learn something that could make all the difference. Let's get started. Please note, this content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a healthcare provider regarding any medical conditions or concerns. Alright, let's dive into the early signs of lung cancer, starting with the first one, persistent cough. A persistent cough is one of the earliest signs of lung cancer, and it's often overlooked because it can resemble a cold or bronchitis. If the cough doesn't go away after 3 weeks or worsens, it might signal something more serious happening in the lungs. This happens because tumors irritate the airway lining or block airways, causing the body to try to clear them out by coughing. A study published in Chest Journal in 2017 found that around 50% of lung cancer patients reported a persistent cough before their diagnosis. This was often the first symptom that prompted them to see a doctor. Coughing up blood, even in tiny amounts, might also occur, but it's not always present. Pay attention if your cough changes in nature. If it goes from dry to producing mucus or becomes deeper and more hoarse, it's worth getting checked. Early detection can make a significant difference. If the cough lingers without a clear cause, especially in smokers or those with a history of smoking, it's important to seek medical advice as soon as possible. Next, number 2. Coughing up blood. Noticing blood in your cough can be alarming. It's one of the early signs of lung cancer. This happens when a tumor in the lungs grows and damages nearby blood vessels. Even a small amount of blood mixed with mucus can be a sign of something more serious. Sometimes people ignore it, thinking it's from a minor infection or irritation. However, research suggests this symptom should never be overlooked. A 2019 study in Annals of Translational Medicine found that around 7% of lung cancer patients initially present with hemoptysis, which means coughing up blood. Early detection in these cases can significantly improve survival rates. The study highlights how even small traces of blood can be a critical clue in diagnosing lung cancer at an early stage. It's easy to dismiss, especially if the bleeding is minor. But it's important to recognize that even the slightest sign can be an indicator that cancer is present. Seeking medical advice if this happens, even just once, could be life-saving. Next, number 3. Shortness of breath. When breathing becomes more difficult than usual, it could be a sign your lungs aren't functioning at their best. For some, this gradual change might feel like normal aging or a temporary issue, but it can actually be an early symptom of lung cancer. As tumors grow, they can block airways or cause fluid buildup around the lungs. This restricts airflow, making it harder to catch your breath, even during light activities like walking. A 2023 study published in National Institute for Clinical Excellence found that around 35% of lung cancer patients reported breathing issues before their diagnosis. In fact, shortness of breath often appears months before other symptoms, which can make it easy to overlook. This research also highlights how the size and location of a tumor play a role. Tumors near the airways or diaphragm can have a bigger impact on breathing early on. If you notice yourself feeling winded during tasks that were once easy, pay attention. It might be time to see a doctor. Early detection can make a big difference in treatment outcomes, especially when it comes to something as serious as lung cancer. Next, number 4. Chest pain. Sometimes, people might notice pain in their chest and think it's a muscle strain or heart issue. But in certain cases, it could be an early sign of lung cancer. This pain often happens because tumors can press against nerves or the lining around the lungs, called the pleura, causing discomfort. It may get worse with deep breaths, coughing, or laughing. Recent studies highlight that nearly 25% of people with early-stage lung cancer report chest pain. A 2021 study in patient preference and adherence found that chest pain was present in a significant number of patients even before other symptoms like coughing appeared. This kind of pain can sometimes feel sharp or dull, and it might be constant or come and go. If the pain lasts or worsens over time, it's important to get it checked out. Catching lung cancer early when chest pain first appears can improve treatment options and outcomes. Remember, it's always best to listen to your body. What might seem like a small issue could lead to an important diagnosis. Next, number 5. Hoarseness. A change in your voice, especially if it becomes raspy or weak, might be more than just a cold. One of the lesser-known signs of lung cancer is hoarseness, and it can be an early signal. This happens when a tumor in the lung presses against or damages the nerve controlling your vocal cords. The nerve in question, a recurrent laryngeal nerve, runs from the chest up to the neck. If it gets irritated or compressed by a tumor, your voice can become hoarse, and this change doesn't improve with rest or traditional remedies. A study published in Primary Care Respiratory Medicine 2020 highlights that about 1 in 5 people with lung cancer experience hoarseness as an early symptom. This is because lung tumors, especially those in the upper lobes, can directly interfere with nerve function. Unlike the hoarseness that comes with a cold, which typically clears up in a week or 2, this voice change can persist or worsen. If your voice has become unusually hoarse for more than 2 weeks, it's crucial to speak with a healthcare provider. Voice changes can easily be overlooked, but catching this early could potentially save your life. Next, number 6, wheezing. Hearing a whistling sound when you breathe might seem harmless, but it can be an early sign of lung cancer. The sound comes from your airways narrowing or becoming blocked. If a tumor grows inside the lungs, it can obstruct airflow. This leads to that wheezing noise when you inhale or exhale. Studies show that this symptom is often mistaken for asthma or allergies. Many people with lung cancer experience it before other symptoms appear. 2023 study published in the BMJ Open found that nearly 14% of patients reported wheezing as one of the first noticeable signs of the disease. The study highlighted how this symptom can sometimes be overlooked in non-smokers, delaying diagnosis. It's important to pay attention to changes in your breathing. If the sound persists or worsens, particularly without a history of asthma, it could be more serious than you think. The sooner you address this, the better your chances of catching lung cancer early. Next, number 7. Unexplained weight loss. Dropping weight without a clear reason can be an early sign of lung cancer. When the body starts to fight cancer, it uses more energy than usual. Tumors can release certain chemicals that change the way your body burns calories, even if you're not trying to lose weight. This often happens before a diagnosis because the body is under stress. Research published in the Journal of Oncology Practice in 2018 showed that about 35% of lung cancer patients experience weight loss as a first symptom. The body's metabolism ramps up, burning more calories to fight the illness, even when food intake stays the same. It's one of those signs people might not notice right away, but it can signal something serious going on inside. If you're losing weight and can't figure out why, it's worth paying attention. Even a small drop can matter. You don't have to be actively trying to lose weight for this to happen, and that's why it's a key sign to bring up with your doctor, especially if other symptoms like a cough or fatigue show up too. Next, number 8, fatigue. Feeling unusually tired or drained, even after a good night's sleep, can sometimes be an early sign of lung cancer. This kind of tiredness isn't the normal kind from a busy day. It sticks around and starts to impact daily life. People may find it harder to concentrate, or they might lose the energy for tasks they used to do with ease, like walking or cooking. The reason lung cancer can cause this kind of exhaustion is because the body is constantly fighting the cancer cells. The immune system works overtime, which can drain energy. Additionally, cancer cells can produce proteins that change the way your body uses energy, leading to this intense feeling of tiredness. According to a study published in the Lung Cancer Journal in 2016, around 60% of patients with early-stage lung cancer report experiencing this kind of overwhelming tiredness before being diagnosed. The study emphasizes that recognizing this symptom early could make a difference in how quickly someone seeks medical attention. So, if you notice unusual tiredness that doesn't seem to have a clear reason, it might be worth talking to a doctor. Early detection can make a world of difference. Next, number 9, frequent respiratory infections. When someone keeps getting respiratory infections, it might be an early sign of lung cancer. A tumor growing in the lungs can block the airways, making it harder for the body to clear mucus and fight off infections like bronchitis or pneumonia. Repeated bouts of these infections, especially if they come back even after treatment, could signal a deeper problem. It's not just about catching colds frequently. It's about noticing when they're harder to shake off or seem to keep recurring. A study published in International Journal of Molecular Sciences in 2021 found that people who experienced recurring respiratory infections were more likely to have underlying lung cancer, especially when the infections were persistent and didn't respond to standard treatments. The study highlighted that about 20% of individuals diagnosed with lung cancer reported having frequent respiratory infections in the year leading up to their diagnosis. If you or someone you know is dealing with ongoing lung infections that just won't go away, it's worth checking with a doctor. Early detection of lung cancer can make a significant difference in treatment options and outcomes. Next, number 10, loss of appetite. When cancer develops in the lungs, it can release chemicals that affect the body's metabolism. This change might reduce your desire to eat. It's a subtle symptom, but significant. Your body could feel full faster or become uninterested in meals you used to enjoy. One of the reasons behind this is that lung cancer often causes inflammation. This inflammation can mess with hormones like leptin, which tells the brain when you're full. When leptin levels increase, it may trick your body into feeling like it doesn't need food. Studies show that around 40% of cancer patients experience this kind of symptom early on. A 2019 study published in Cancer Medicine found that nearly 30% of individuals with early-stage lung cancer reported appetite changes before their diagnosis. This is one of the factors doctors consider during screening. If you notice this happening alongside other symptoms, it's worth having a conversation with your doctor. Early detection is key, and even small changes in how you feel about food could be a red flag worth checking out. Next, number 11, bone pain. When lung cancer spreads to other parts of the body, it can sometimes reach the bones. This causes pain that might feel like joint or muscle pain, but it doesn't go away. You might feel it in areas like your back, hips, or even ribs. The pain can be dull and persistent, making daily tasks harder. It's not always easy to connect this pain to lung cancer, but research shows it's an important early warning sign. According to a 2012 study published in Clinical Medicine Insights, Oncology, nearly 30% of patients with advanced lung cancer reported bone pain as an early symptom. The pain is often a result of metastasis, where cancer cells invade bones and cause damage, weakening their structure. This can lead to fractures if left untreated, which is why catching it early is crucial. People sometimes overlook this symptom, thinking it's due to aging or minor injury. But if the pain doesn't improve, it's important to get it checked. Early detection of lung cancer, even through unusual symptoms like bone pain, can improve treatment outcomes and quality of life. Next, number 12, headaches. Sometimes headaches can be an early sign of lung cancer, but they often go unnoticed because people usually link them to common causes like stress or migraines. However, lung cancer can cause headaches when a tumor creates pressure. For example, if a tumor grows large enough, it can press against the superior vena cava, a large vein that carries blood from the head to the heart. This pressure reduces blood flow, causing headaches. It's called superior vena cava syndrome, and research shows that about 3 to 4% of lung cancer patients develop this condition. Another way lung cancer can trigger headaches is when the cancer spreads to the brain. According to a 2021 study in the International Journal of Molecular Sciences, brain metastasis occurs in about 20% of non-small cell lung cancer cases. These secondary brain tumors can cause headaches that are often worse in the morning or accompanied by nausea and vision changes. If you're experiencing persistent headaches, it's important to be aware of these possibilities. It's always better to check with a healthcare professional, especially if the headaches don't seem to have a clear cause or come with other symptoms like breathing difficulties. Early detection can make a big difference. Next, number 13, swelling in the face or neck. Sometimes, a tumor in the lungs can press against a large vein called the superior vena cava. This vein is important because it carries blood from the head, neck, and upper chest back to the heart. When the tumor presses on it, the blood flow slows down, causing swelling in the face, neck, and even arms. This could be an early sign that something isn't right in the chest, potentially indicating lung cancer. In 2023, a study published in Polish Journal of Thoracic and Cardiovascular Surgery highlighted that superior vena cava syndrome, where this vein gets blocked or compressed, can be one of the first noticeable symptoms in some lung cancer patients. The study showed that around 4 to 5% of people with lung cancer experience SCCS early on. People might notice their face looking puffier in the mornings or their neck feeling tight, especially when lying down. These symptoms often get worse over time, and the skin might take on a bluish tint due to reduced blood flow. Early detection is crucial because once this kind of swelling appears, the tumor may be affecting key areas around the lungs. If you or someone you know notices these changes, it's essential to speak to a doctor right away. Next, number 14, finger clubbing. When your fingertips start to widen and nails curve downward, it could be an early warning sign of lung cancer. This happens because tumors in the lungs can interfere with the body's circulation, reducing the oxygen levels in your blood. As a result, tissues in your fingers respond by swelling and changing shape. This is why your fingers might look different, and it's worth paying attention to. A 2020 study published in International Journal of Advances in Scientific Research found that clubbing appears in around 35% of patients with lung cancer, especially those with non-small cell lung cancer, NSCLC. The study pointed out that this change is due to increased blood flow to the area, as the body tries to compensate for low oxygen levels. You may not think much of changes in your fingers, but they can be an important sign to get checked out. It's a subtle symptom that can be easily overlooked, but research shows it often shows up before other more obvious signs, like coughing or chest pain. If you notice this, consider seeing your doctor for further tests. It could be a small change that saves your life. Next, number 15, shoulder pain. Feeling pain in your shoulder might not seem connected to your lungs, but research shows it can be an early sign of lung cancer. This happens because tumors located at the top of the lungs, called pancreas tumors, can press on nearby nerves. These tumors affect the brachial plexus, a network of nerves that run down your arm. As a result, the pain might start in your shoulder and spread down your arm or to other parts of the body. A study published in Radiology Case Reports 2024 found that about 44% of people with pancreas tumors reported pain that started in the shoulder. The pain may not always be sharp. Sometimes it feels like a deep, dull ache. It's often worse at night and doesn't go away with rest. What makes this type of shoulder pain different is that it isn't caused by physical injury or overuse. If you notice ongoing discomfort in your shoulder, especially if it's combined with other symptoms like a cough or shortness of breath, it's important to get it checked. Early detection can be crucial for treatment. And there you have it, some of the most important early signs of lung cancer you can't afford to ignore. Remember, spotting these symptoms early could make all the difference. If you or someone you know is experiencing any of these signs, don't wait, get checked. It's always better to be safe than sorry. If you found this video helpful, please give it a thumbs up and share it with someone who needs this information. Early detection saves lives, and together we can help more people become aware. Don't forget to subscribe for more health tips and hit the notification bell so you don't miss any updates. Thanks for watching, and take care of yourself and your loved ones.